Welcome to State of Mind, Being Human and Living Well. I'm the producer and host, Deborah Sloss, licensed marriage and family therapist, and my pronouns are she, her. About 1/3 of people who have a mental disorder will also have a substance use disorder at some point in their lives, and vice versa. In 2020, the National Survey on Drug Use and Health reported 17 million American adults experience both mental illness and a substance use disorder. These conditions occur together frequently, and either disorder can develop first. The interactions of the two conditions can worsen both. When these two illnesses occur together, they're often referred to as dual diagnosis or co-occurring disorders. And since the pandemic, the numbers of people with these conditions is even higher. We're also having today's conversation while our country is engulfed in a worsening drug overdose epidemic, with too many of us having lost friends and family members to it. In 2021, more than 106,000 persons in the U.S. died from drug-involved overdose. And while the rate of increase has fortunately slowed some, the number of deaths by overdose more than doubled between 2015 and 2021. In today's show, we talk about the intersection of substance use and mental illness and the ways each condition affects the other. While this interview was originally recorded in 2019, for today's show, it's been re-edited and we've added new content. In the interview, I'm joined by guest Rick and psychotherapist Cynthia Nollenberger to discuss dual diagnosis and hear a story of remarkable fortitude. We explore the challenges and complications unique to dual diagnosis and share resources that can be of help. For those of you familiar with State of Mind shows, you know that we frequently discuss the pervasive stigma associated with mental health. Part of the mission of this show is to try to reduce that stigma by creating a forum for people to speak out about how mental illness has impacted their lives. While Rick wanted to share his story, he didn't feel he could share his identity without potentially impacting his employment opportunities. So he uses a pseudonym in this show. Let me tell you more about the guests. Rick grew up and continues to live in Santa Cruz, California. He's an experienced artist in many mediums. Rick said at the time of the interview, the defining feature of his life had been his experience with insanity. I caught up with Rick as we got ready to remix this interview, and he told me that he was doing better than ever and had been experiencing continued healing through his more recent spiritual practices. Cynthia Nollenberger is a licensed marriage and family therapist who's been practicing for the past 20 years. She works in private practice in Aptos, California, and is part of the Mobile Emergency Response Team for Santa Cruz County Behavioral Health. Cynthia is also part of the CIT, or Crisis Intervention Training Team for law enforcement, and is also part of the Suicide Prevention Task Force for Santa Cruz County. Cynthia has worked with adults and teens individually and in group settings, addressing substance use, mental health, and dual diagnosis issues in many settings, including schools, clinics, jails, and hospitals. Here's our interview with Rick and Cynthia. So can we start with you, Cynthia? I was thinking we could start by maybe clarifying some definitions for our listeners. Like, what is dual diagnosis or co-occurring disorders?
So dual diagnosis means that you have both a mental health issue and a substance abuse issue. And so as far as the mental health, it can be bipolar disorder, it can be major depression, it can be schizophrenia, along with a variety of other things. Co-occurring disorders means the same thing. Mm-hmm. It's pretty much the same thing.
Okay. And why do you think it's important to have this discussion like at this time?
So I think we've come to this juncture where it's really apparent that both of them coexist together oftentimes. Mm-hmm. So because of that, and because we have such a huge homeless population in Santa Cruz that deal with both substance abuse and mental health issues, we see it every day. We see it every day in our streets, and it's so obvious to people who live here, and it's so sad. And we are working to reduce stigma for sure through NAMI. or NAMI, depending on how you pronounce it.
Do you want to say what that is? Not everyone might know.
Certainly.
Yeah.
It's the National Alliance for Mental Illness, and they're great advocates for the homeless population and mentally ill population. So as far as what we need to do moving forward, there are a lot of things that are becoming apparent in our city and in our culture, and that is that we need to help these people. It's not okay for people to be on the streets and being living. It's cold right now, so that's just it's just not okay. It's very sad to see that.
Yeah.
And not everyone experiencing dual diagnosis kind of issues is on the streets either,
That's
right?
right.
You want to say something about the sort of breadth of...
Yes. So people living on the streets can be either, and they can be either or both. They can be homeless and mentally ill. They can be homeless and drug addicted, or they can be mentally ill and drug addicted living on the streets. So it just depends on what's going on. It's really hard to suss that out until you spend some time with them to see what's going on.
Some of our listeners might be concerned about a family member, and I'm wondering, what is usually most visible to the outsider? Is it the mental health issue, or is it the addiction issue that often sort of stands out?
Yeah, so like I said before, it's a matter of spending some time with them to suss that out, because you can't tell if someone's mentally ill or a substance abuser unless you spend a little bit of time with them. Because psychosis and being the mental health component of psychosis can just be that, or you can be under the influence of methamphetamines and look like you're psychotic. And sometimes it's both, but it's a matter of time, spending time with them and trying to come up with a diagnosis to figure out what's really going on, and then treatment measures from there.
Okay, and is it important to understand dual diagnosis or co-occurring, I have trouble with that word, co-occurring disorders specifically and differently than simply an addiction issue?
Absolutely, because what happens is with people who have, so say someone has a trauma as a child, that puts them in a vulnerable position. One, to become, for example, to have depression, or if they have trauma in their family because the family has a history of mental illness, that is another component that can weigh in. So it's again a matter of sussing it out and seeing, like, getting their history, finding out what's happened in their family. Is there addiction in their family? Is there mental health issues in their family? With trauma, then that sets up a situation where somebody could likely become substance abusers because they don't feel good inside, because there's traumas that's not been dealt with. And even when people work with it a lot, it's still pervasive, and it still haunts them oftentimes.
So, Rick, you're here today. You are here to share some of your experience about mental illness and addiction and what that road to recovery looked like for you.
Yeah.
Yeah, and can you tell us about the emergence of your mental health issues?
Yeah, totally.
Yeah.
I was kind of a weird kid, but it was the kind of thing where, like, normal adolescents would kind of get rid of that. However, I mean, should I just talk about my drug use as well?
Yeah, I mean,
Okay.
how old were you when you started to recognize some symptoms either of the drug use or of the mental illness?
Well, I mean, when I was a kid, I would, like, wander around the schoolyard singing to myself and stuff, which, like I said, can become normal later on. I just never had that get normal because I took a very large dose of hallucinogenic mushrooms at, I think, 16, might have been 15, and just went totally crazy. And that made it so that the sort of adolescent weirdness didn't go away for a long time. So I went crazy on a dose of mushrooms. Like I said, I took a quarter ounce of mushrooms, psilocybin-containing mushrooms, and heard a voice, kind of thought it was like a past life of mine, and made some kind of deal with it. So to me, there's like for a long time I was thinking there was some kind of supernatural aspect to that, which is definitely something insanity will perpetuate. But sorry, I'm like out of it for some reason.
It's okay, just
So
take
bear
your time.
with me,
Yeah.
Yeah, so for the next 5 years, I was untreated wasn't on meds, was lying to the doctors that were interviewing me so that they didn't know that I had this voice in my head, and just was volatile, just really wasn't part of this world. I mean, there's an easy, I mentioned in an email to you that being crazy was fun, and it is like it was very hard. Like, something was essentially yelling at me for 5 years in my head, and I couldn't get rid of it. And but then again, there were like all these cool aspects of it. Like, if you're distracted from the real world, you're kind of like not, you don't have to be a part of society. And society, you know, as we all know, can be very limiting. And so it's kind of like, I think it's a lot of people's dream to like be rid of social pressure and all that stuff, and you kind of get that when you're crazy. And then at the same time, it's just like, it's hell, you know. So it's really like, it was, yeah, I mean, my dual diagnosis essentially started at the mushroom trip, and I continued it by smoking weed and a lot of other stuff.
Did you see changes in your sort of mental health experience as you used drugs? In other words, did those drugs help in any way, or did they make it more difficult for you?
Yeah, you know, I went to a few recovery programs, and one of the main tenets of the main one is that drugs are a solution that then become the problem. Because a lot of people in recovery like have huge issues that are underlying, and then they eventually realize that drugs aren't the answer and that they're actually making them worse. So yeah, drugs played a role in my recovery for sure. And I would say that I probably wouldn't have survived without using drugs, but then again, it got worse because of drugs.
What happened from there? You know, you started having these voices. You were, you said, lying to, you know, your care providers, not really letting them know about that. But something must have shifted at some point, because you're sitting here with me talking about it now and from a very different perspective.
Yeah, I think that, and this is a really important kind of unique thing in my experience, is that I was never arrested. I was never forced into mental health, into a mental health facility or a situation like that. And eventually I was just like, this is, I mean, you know, just to be real, it was like either suicide or look for help, because it was that bad. Like, I was like, and I just kind of weighed those options, and it was kind of like, well, if I die, then I don't have the chance to look for help. Whereas if I look for help, you know, I mean, there's always that option, but you know, now it's pretty far from my mind, suicide. But at the time, yeah, it was just like, it was like, well, I could either ask for help or I could just give up. And I think that was really important. And anyone out there that's sitting with insanity that they're not really comfortable with talking to people about, I would encourage them to kind of weigh, you know, hopefully you're not considering suicide, but just like, help is out there. And if you look for help, it is completely different than like people trying to force something on you. And there's nothing wrong with like people forcing things on you, because sometimes that will help you, but it definitely creates a different reaction to it, especially when you're younger. If someone tells you take this, you're probably not going to want to take it. But for me, like, I was like, well, I made this decision. I think I must have been like 21 at that time, and just kind of told my parents that I wanted to see like a psychiatrist or a psychologist. I think I saw a psychiatrist first. Started on a bipolar drug that also treats some other symptoms, some other issues besides insanity. And the second psychiatrist I saw talked to me for like a half hour and prescribed me an antipsychotic. And I started taking it the next day, and the voice went away, like overnight. And that was like nuts. That was absurd. And so I mean, that, like, I kind of bought into Western medicine with the first medication. I was like, this does something.
Because you were feeling better in some ways.
Yeah,
Uh-huh.
yeah. But there was still the voice. There were still lots of issues. But after the second medication just kind of like had that drastic of an effect, I kind of bought into it, just in the sense of, like, I don't think that Western medicine and medication are the only cures for psychosis. They may be for severe psychosis like I had, but I don't know. And Western medicine worked for me, so that's the only reason that I'm on all these medications now. But the second med, I took for a while before I was told that I had been diagnosed with schizophrenia, and he also diagnosed me with bipolar based on my reaction to the other drug, even though I hadn't had a bipolar diagnosis before that. So suddenly I find myself with a bipolar and schizophrenic diagnosis. And so my dad kind of let that slip at one point, and I was like, oh man. And I was traveling a lot around the Bay Area at the time, kind of to like escape people that knew me as crazy, which is kind of like something that was really interesting. Like I was like, why was I traveling so much? Why was I like driving all over the Bay Area? And that totally was it, because I just wanted to go places where people didn't know me as crazy.
You could have a fresh start.
Exactly.
Yeah. Reinvent yourself.
Yeah. So that was interesting.
So can I just pause you for a minute? Because, you know, when you're talking about this, about these sort of layers of discovery and figuring it out, sometimes through the back door, which is through the medication, helping figure it out. I'm just wanting to sort of turn to Cynthia for a minute from her experience and ask, is that something like clinically or that you've seen when you're working with people, that and does it frequently take a length of time to kind of get to a medication or a combination of medications that are going to help people?
Well, good question. And yes, sometimes it can take a lot of time.
Yeah.
You go to a psychiatrist and you tell them your symptoms. If you're being honest, then he can or she can prescribe something that's more appropriate. If you're not being honest, then they're shooting in the dark.
Yeah.
And the other thing, if you're still using street drugs, it blocks the receptor sites, so the medications aren't nearly as effective. In fact, sometimes it's like not getting any medication at all.
Yeah.
Or barely getting any.
Yeah.
So it's important that you're super honest with your psychiatrist so that they have a full picture. And if you're not feeling good on the medication, not just stop it, but to talk to them about it.
Absolutely.
So they can adjust.
Okay.
I also want to speak to, there are times when people, two things. One, there are times when people start feeling better on the medications, and then they say, well, I'm feeling better, I'm going off the medications.
Yeah.
Not good, because that can take you right back to where you were. It might take a little time, maybe 2 months, 6 months, but oftentimes you'll be right back there.
Yeah, definitely. I mean, I think that there's a want for a crazy person to like understand what they're going through, and if you can rationalize something like that, the human mind is capable of rationalizing like anything, and the sooner you understand that, the better. Because if you're insane and you take a med and you say, oh, now I'm better, this is this, I can rationalize this now when I'm off this med, and I can like convince myself to be better, and it just doesn't work that way. It just doesn't. You'll just go crazy again, which is
And the frequency of that is so much higher with mental illness than it is with, I mean, people struggle with taking their medications with all kinds of illnesses, right?
Yeah.
But in mental illness, so much more, right? Why is it so hard for us to believe that it's real?
Well, meds aren't fun.
Yeah.
No, they're not.
Yeah.
I mean, I've even worked with people who have diabetes and they don't want to take their diabetes medicine because they don't want to be diabetic.
Yeah.
And I think the same thing happens with people who have mental illness. They don't want to be mentally ill. They don't want to take a drug that means that they're mentally ill. It's important to continue.
This is State of Mind, Being Human and Living Well. I'm your host, Deborah Sloss. In today's interview, I'm talking with Rick and psychotherapist Cynthia Nollenberger. We're discussing dual diagnosis. That is, when someone suffers from both mental health and substance use problems at the same time. While the opioid crisis has been capturing national attention, The fact that many of these folks additionally suffer from mental health problems and would be considered dual diagnosis patients is more rarely discussed. These co-occurring disorders make for complicated recovery because each condition affects the other. Rick shares about his journey first to mental health recovery and then some years later, making his way to substance use recovery. Before we get back to our interview, we want to share this In Your Voice story we received from a community member about her dual diagnosis recovery. Here's Marianne.
Hi, my name is Marian. I'm a 68-year-old retired social worker. I worked in a homeless shelter for adults with severe mental health diagnoses. I wasn't officially diagnosed with depression or took meds until I was in my late 50s. I started drinking, though, when I was 13 years old as self-medication, growing up in a toxic, abusive home. I left home at 18. Immediately, I started cutting while I continued to abuse alcohol to numb the negative and catastrophic thinking that plagued me. Throughout my 20s into my 30s, I struggled with anorexia and acted out sexually as I thought I was too hideous to deserve love, although I sought it out constantly. I suffered from low self-image, low self-esteem, social anxiety disorder, depression, body dysmorphia, and suicidal thoughts while drinking incessantly. I was looking for relief from my own mind. I married for the third and final time when I was 36 years old. I found a man who wanted only my happiness. It took me a long time to believe I deserved him. I continued to suffer from all those same issues, coupled with night terrors and PTSD from the abuse I'd endured for years. I also worked and graduated from college at 50 years old. Soon after graduating, I began work as a case manager at the shelter with homeless men and women whose lives, I would find out, often mimicked my own. It was here where my internal dialogue completely changed. A coworker shared an understanding that I'd never heard before, but knew the essence of, as I'd always reminded myself that life is all mind over matter. What she shared with me and others was simply that we are all thinkers, and those thoughts create feelings that we react to. I learned that thoughts have no value until we decide they do, and importantly, thoughts are temporary. From this, I began to realize and teach that feelings like shame, guilt, or cravings are all created by us, the thinker, not by the past or by feelings in the present. What happened is I listened, learned, and evolved. I thrived. I learned that no one starts using to feel worse. We all reach for something or someone to feel better. And there should be no judgment in that, as it's all we knew at the time. I learned to trust that we are doing our best, even on low mood days, during bouts of insecure thinking, in the middle of seemingly irrational actions, or when we're craving something that we know is bad for us. I learned about compassion for myself and others. I also found help with my own depression during this time, as I no longer felt doing so made me less of a person. It was thrilling to give a name to all that I'd suffered from. It seems we can change no matter how long it takes or what age we are. What a relief.
Now, back to our interview. You know, I'm just humbled as I sit here and think what a road you've been on, and, you know, just how challenging and how lucky in so many, like you've said at multiple points, you feel lucky that you are here. And were there, you know, when you said the recovery was really hard, or making the decision even to get help, like, were there people, and you said there are people to talk to, were there people you talked to or that really made a difference, helping you kind of keep making that decision to take better care of yourself? And
I think I would say my therapist, who I'm not sure would like to be mentioned, but yeah, she definitely, I credit her pretty much with my recovery. And yeah, because I was making a lot of bad decisions, and she, you slowly understand that psychiatrists or psychologists have your best interest in mind, but that their tactics aren't always what you think they are. And she definitely was able to use those and just like got me out of it. I mean, I think I always say that like there are like a few levels of what helped me. And the first one was like me, like I just kind of have a tenacity to like survive. That's also in my family. My grandmother, like when she was older, would just get injured over and over again and just heal through these crazy injuries. And it was like, wow, like you really want to stay alive. And so I kind of got that probably from some part of my family. And then probably my parents, because without my parents' continued support, if you're on the street or if you don't have access to good doctors, like, your chances are lower unless you do have that tenacity to a degree. And then I would say my therapist was probably the third most important thing. And then I'd say like privilege, just, white privilege, male privilege would be the fourth, because like I was wandering around the west side really late at night, in a hooded sweatshirt with a skateboard, and if I had been black, like you never know. Like it's not necessarily like anything would have happened, but it's definitely like it certainly helped me that I was the kind of person anyone would look at, white would look at and be like, oh, this person's not a threat, because I did a lot of sketchy things, and I just don't know that would have been the same if I wasn't white, if I wasn't a guy. And so, certainly women get taken advantage of a lot more than guys do. So sort of lucky in those ways. Mm-hmm. But so those things I think helped me the most get through it.
Can I ask, what was the turning point for you to stop using drugs?
That's a really good question. Probably when my friend died. Or maybe when the formula shifted in that drug we were talking about, painkiller. I think that, something was sort of like, something happened along the lines of, it's either drugs or life, and he didn't have the choice. He didn't get to live. And so it was like, well, what am I doing if he helped me do this? And I've made all this progress towards sanity. And then it just built this momentum. And I really just was like, okay, if I stop now, I'm giving up like all this. And so I think the longer I stuck with it, like right now, like taking a bong rip would just be like absurd. I would go back to some level of insanity, and it would take me like months to recover. And I'm just like, do I really want to do that? Like, I like drugs. I love drugs. They're fun. But they're not fun when they drive you crazy. Mm-hmm. And for me, like, I just can't do that at this point in my life and continue to live like the life that I have. So I think that, to answer your question, it was sort of like, what else could I do besides, keep getting better without disappointing like myself? Not so much disappointing, but like without throwing everything away.
Sounds like you really grasped the gravity of what was at stake for you at that point.
Yeah, I guess so.
Yeah, it takes time sometimes to get to that point.
And
it took a while.
I've often seen that too, where there's like a series of events that happen, and then you just can't not look at it anymore. Yeah. It's like not an option.
Yeah.
So going back briefly to something that you said earlier, you were talking about, what made a difference for you, and it made me think, I have previously done a show on NAMI, National Alliance on Mental Illness, and you said your family played a really key role, and the reason I want to bring it up is because it can be really hard for family members to be supportive when you're watching someone make choices that are so frightening for you. And so there's a lot of support available for families through NAMI.
Is that Al-Anon? Is that NAMI?
Al-Anon is a different program, but there's also support through Al-Anon. So both of those. NAMI focuses primarily on mental health, but also many of the issues involve addiction too. And Al-Anon has some wonderful tools too. And families get lots of help in terms of how to be able to be helpful to their loved ones.
Absolutely. And I
through
think
those
that
programs.
I think that they took advantage of some of that.
Your
Certainly
parents
more
did?
than I did.
Mm-hmm.
Yeah.
Mm-hmm.
Yeah.
I guess I want to kind of go to Cynthia. Like, so you see all this happening, and people listening might be like, some kids or teenagers are just experimenting with drugs, and their family members might be watching and feeling concerned. Is there anything important about prevention that you would want to share with them?
Yeah, absolutely. So some kids are just experimenting, but experimenting is the first step into other things. Mm-hmm. But I would say, as far as to parents, if your kid is like stopping having interest in things that they've had interest in before, or they don't want to go to school, or they're having more problems, or their peer relations are suffering, or your relationship with them is suffering, there's something going on. Whether it's substance abuse or whether it's something else, it's really important to look into it. And listen and be present for your kids. And I know that there's a lot of parents out there who work and can't be present all the time. But if you can't be present all the time, make sure that you're checking in periodically to know what's going on, or have them be around other relatives who are close to them so that they can, give you feedback, get to know their friends so that if they're in distress, their friends will call you to help them out. So
I also think that if you have a history of mental illness, and you have a child that's going through or having some problems, that's a big red flag.
Yep.
So what do you think is important? Would you think it would be important to share that information about mental health with that young person? Or when you say that's a big red flag, how would you...
I just meant like what you were talking about with your kid not, having the same relationship with you. If you also have a history of mental illness in your family, then you need to be especially vigilant.
I see, because they're at higher risk. Just pay really close attention.
Yeah. My family didn't really have a risk. Even though my family didn't really have a history of a mental illness. I mean, personally, I'm not going to have children because this is hereditary. And kind of your kids are people you care about, your grandchildren are people you care about, and I don't want anyone that I care about going through this. So that's sort of something for me. But I think the carrier thing that you meant, I consider it carrier, where like you have a gene that then if you trigger it, that's insanity. And I think that that's something that, definitely is real.
And I want to speak to that point too. I think that's super important, that if you know that there's that family risk, or in that you're biologically loaded, that have that conversation with your kids.
Yeah.
Because knowledge is power. So if they know, like, if I drink, this could happen, or if I use, this could happen, then they have that information. If you don't give it to them, they're like, well, why didn't you tell me? Like,
yeah,
they don't always use it right away.
No,
but it's still important that they have
That's right.
it. Yeah,
that's right. And just speaking to parents out there, kids at 15, 16, 17, they think they know everything, and they really don't. And usually when kids are like a little bit older, they're like, oh wow, I didn't know anything. I thought I knew everything. I didn't know anything. So just know that you're up against that, and they've got one foot in the kid world, one foot in the adult world, and they're trying to navigate that. And so they want to try to be as adult as they can, but oftentimes they're not. They can't be, because their brains aren't developed at that point. So,
yeah. I would also say, as far as speaking to kids, I just would say, as far as drugs, like, be careful with hallucinogens, and that includes marijuana. Just like be very careful, like be a scientist about it. Don't just dive in. And
is that based on your experience of taking such a large dose? Is that kind of what you're thinking?
I mean, kind of that, but it's also from seeing friends of mine, like, it's like, oh, this is cool, I'm going to do it, it's fun, and then it's just like, it wasn't fun. It turned out badly. Whether it's a bad trip or whether it's something longer term. And then as far as like opiates are not they're like the most beautiful girl you never want to date.
Mm-hmm.
It's just like,
I love that analogy.
it's too good.
Mm-hmm.
Yeah. And then my only experience with uppers is I was prescribed some amphetamines by that doctor that I mentioned, the first psychiatrist, and then I like ended up driving around San Jose at 3 a.m. after taking 3 when I was told to take 1 a.m, and I just dumped all the pills into the trash because it was the same thing. It was just like dangerous.
Mm-hmm.
It's like, yeah, and you don't want to use that spark and then become a bonfire or wildfire.
I totally hear what you're saying. I love that analogy too. I often, in working with people, especially working with older people like adults who at least have the experience of having a relationship, whereby it does become your primary relationship.
Yeah.
It is the relationship that you're having.
Yeah.
So in working with them, as far as in substance abuse treatment, I often ask them to write like a Dear John letter or a Dear Joan letter.
A breakup letter.
That's right. That's right.
Yeah.
Mm-hmm.
I
And
can
it's
see that.
really eye-opening because it's like, wait, oh my gosh, they're not good for me.
Yeah. Yeah.
And if you
totally.
could take
Even
it
while
out
a
of it.
part of me still loves them.
That's right.
Yeah.
Love them.
Yeah.
Which
Oh,
is what
man.
you've spoken to today, definitely.
Yeah.
Yeah.
Yeah. It's
Yeah.
yeah.
Mm-hmm.
So I am thinking about, as we talk about the dual aspect of the diagnosis, if people are looking for help, is it important that they think specifically about that dual diagnosis and what kinds of help is out there for people?
So I think, of course, if they know that that's what's going on, and a lot of times people don't know what's going on. They know something's wrong, they just don't know what it is. Especially with mental illness, they can kind of like, I don't feel quite right, but I don't know what it is.
Yeah. It's hard to know while you're in it.
Absolutely, and see the forest for the trees and all that. And yes, there is help out there. One of the great things that happened just this last year, starting January of 2018, is Medi-Cal now is available for people to get drug treatment. That was not the case before. We had drug Medi-Cal, but it was only to serve youth as a preventative measure. But last year, for people on Medi-Cal, you can now get drug treatment through Medi-Cal. Which is
Street drug treatment. Oh, that's okay. Yeah. Sure.
Right.
Yeah.
So if you're having
great.
both a mental health and an addiction issue, you can get help for
That's
that.
right. And
Good.
a lot of hospitals,
huge.
it's huge.
Yeah.
A lot of hospitals also do that, or dual diagnosis treatment centers. There are several in the area. Janus does drug treatment, and so El Camino does IOP level of care, which is intensive outpatient, and they have dual diagnosis, they have substance abuse, they have mental health treatment for adults and children, or teens, I should say, not children. And all of that is available through insurance-driven means. And if you're questioning it, you can definitely go to your physician, your primary care physician. They know about these facilities. You can also call your insurance company and let them know what you need, and they'll give you a list of providers that offer those services that are covered under your policy. I think that's super important. And then some families choose either to send their loved ones to some place where they feel really good about, like the Bill Wilson Center, or to Malibu, or there's places in Arizona.
These are like residential treatment
That's-
centers
that's
you're
right.
talking about.
That are very expensive, but if that's what your family wants to do for you and they're willing and able to do it, that's great.
Yeah. I mean, if they can afford it.
That's
yeah.
right.
This is State of Mind, Being Human and Living Well. I'm your host, Deborah Sloss. In case you're just joining us, today I'm joined by Rick and psychotherapist Cynthia Nollenberger, and we're talking about dual diagnosis or co-occurring disorders. Rick has been sharing his personal story of recovering from both mental illness and substance use problems. Since the passing of the Affordable Care Act in 2010, new insurance plans are required to offer more comprehensive coverage for both mental health and substance use treatment. So for many Americans, dual diagnosis treatment options are more accessible than ever before. Every State of Mind episode has a resource list, and all the resources we talk about today and more can be found in the show notes for this episode on our website. You can also listen or subscribe to our podcasts on all the major podcasting sites and on your home smart speaker. Show notes, resources, our podcasts, and where to subscribe to them can all be found at www.stateofmindmedia.org. Now, back to our interview. I was thinking a little bit about sort of the difference maybe with adults and young people, you know, young adults or teenagers, in that is it common that in young adults or teenagers that the addiction kind of is out in front, like that's what you see,
Of course.
because the mental issues are still sort of emerging, or and so, you know, what would you say about that in terms of your experience? You know, how do people suss that out?
Yeah.
Or
So I'd say we see both. So first of all, you're right in that sometimes mental illness doesn't start rearing its head till 18, 19, 20, 21, 22. I mean, that's sometimes that's like the place where it starts to really get bigger. However, oftentimes puberty is an onset. So then it starts growing, and again, kids don't necessarily know what's going on. They know they don't feel good. They know they don't feel like going to school or seeing their family or seeing friends. They don't know why. Oftentimes then they go to online sources whereby, you know, they get connected with friends who live in another country, and that becomes their whole world, and they just close everything down and into that because they're so distressed and they don't know what's going on. And then if anybody introduces any kind of substances to them, it's on because it makes them feel different. Of course, you're going to get a bump up of dopamine and serotonin, and it's going to make you feel better. That's what happens. That's why you don't feel good when you're having, especially depression or bipolar disorder. So with the onset, when you start using drugs, it makes you feel better, at least for a short period of time. So then it's like, then that reinforces you. We have this mechanism in our brain when something works good for us, including eating. It's a very old mechanism.
Yeah.
We keep doing it. So it's a reinforcement. So you're kind of getting doubly reinforced, right? Because you've got these medications that make your body go into withdrawals, and at the same time your brain's got this function going, oh, that feels good. Let's do it again. Let's do it again. Let's do it again. So,
speaking to part of what you said, I would, as I became more lucid, I left painkillers behind, and at that point I decided that, you know, weed was over, and I moved on to nicotine, caffeine, and sugar. And those to me were I've been off drugs for probably 4 years or something, but I really don't consider myself sober. I really didn't consider myself sober until a few months ago because I quit caffeine and quit smoking. And there's some research that came out recently. I'm not sure if you guys are familiar with it, that cigarettes are causal for schizophrenia.
I know that they go together, and that about 90% of people with schizophrenia smoke cigarettes.
Yeah, and I think that I found that when I quit cigarettes, it severely made schizophrenia better. Yeah, there's a study out there somewhere.
Wow. Well, there is a lot of chemicals. I mean, I've had people have a harder time quitting cigarettes than almost anything else.
It's a heavy one. I mean, I still eat nicotine gum every few days. Yeah. But then sugar puts you in a fog. It's just, you know, sugar is terrible. But when I left painkillers, I went to caffeine and was drinking 800 milligrams a day, something like that, which is I think 8 cups of coffee, something like that. And so yeah, it was a hard drug, you know, and it's easy to treat anything like a hard drug if you've been doing hard drugs. But I will say that I didn't OD on caffeine, and it actually worked as far as a replacement that then I was able to wean myself off.
Right.
Whereas with something like painkillers, sometimes you just don't have the chance to wean yourself off.
Right.
And so...
Well, they call that kind of a harm reduction approach,
exactly,
I believe, where you might
Yeah.
replace one thing with something else that has less severe consequences for you.
But it's still, I mean, caffeine cost me a few jobs, I think. And it's just it can still make you very psychotic or, you know, give you some symptoms.
Mm-hmm.
So it's not... Yeah, I don't know, but just point being that that I went insane and became sort of a druggie at 16, and now I'm 32, and I consider myself kind of in the clear now, in the sense of if barring things going wrong, I'm okay, and it's a long time. Recovery took a long time.
Yeah.
Yeah.
Well, we are coming close to the end of our time. Before we finish up, there's a couple questions I definitely want to ask. If you were going to say, if there was one thing that you know now that you wish you had known, and you can name the age, at a specific age, what would it have been?
I just think that, I mean, this pretty much applies to anyone. I'll kind of take your question and twist it a little bit. I think if you feel like there's something wrong, there probably is. Like, I remember I also had a heavy concussion before I had the mushroom trip. And I do remember distinctly, this happened a few times, the memory of things changing. You know, and being like, oh, life was different, and then it fades and you become this new reality. And if you experience that, like, it's real, and you definitely need help. And, you know, you shouldn't, I guess my advice to someone would be, look for help. Don't let a crisis happen so that help finds you. And sort of, if it's your choice to look for help, it's very different. And so I wouldn't wait for something to happen. I would like actively be like, something's wrong and I need to look for help, because you deserve that. You know, it's nothing to be ashamed of to have a problem and to need help. It's just part of life.
Yeah. Yeah.
Oh, another thing would be just to do art. If you're stuck in a situation where you're kind of isolated or whatever, like, do art. It will get you through a lot of stuff. Like, I definitely learned a lot of what I know about music and writing, which are my two primary art forms.
Just before we finish up, Cynthia, I'm wondering if there's you mentioned a few things, but if there are very specific and local resources that you would want to make sure that our listeners know about, and we'll make sure that those are also posted on our website.
So first of all, definitely want to mention that, like we were talking about kids before, and if your kids are acting different or looking different to you and something seems amiss, please go have them assessed by your primary care doctor. They can look at them and talk to them and see if they can assess what's going on. It may be something minor, it may be a medical issue, or it may be something that's an emerging mental health issue or a substance abuse issue. So in this area, I would definitely advise that if you have Medi-Cal and you want to get mental health or substance abuse treatment or dual diagnosis treatment or treatment options, you can go through Santa Cruz County Behavioral Health, and they can do an assessment and direct you in to different venues that would be helpful. If you are covered by an insurance-driven mental health or substance abuse plan, then go through your primary care, or not your primary care, but your insurance.
For private insurance. Okay.
Yeah. And then there are definitely things like AA, NA. AA is Alcoholics Anonymous. NA is Narcotics Anonymous. There's Marijuana Anonymous, and various other anonymouses, including
Smart Recovery, because that definitely, yeah, sure. I just felt like this was a good time to
absolutely.
mention it. It really helped me, and it's not only helpful in the sense of you hear stories, but it's also like you get to tell what you know, and that reinforces your own recovery as far as being able to say, this is what I did, makes you feel responsible to do it. And so it's a very useful tool. So if people are looking to get clean, I highly recommend Smart Recovery. And
it is a CBT, cognitive behavioral therapy based treatment, versus NA, which is an abstinence based model. And then there's also refuge recovery, which is Buddhist based. As far as getting other help, there's residential level of care, there's partial hospitalization level of care, and there's intensive outpatient level of care. And then there's also just seeing a therapist. That can sometimes be the crux or the turning point. Also, I've had people get clean and sober by starting to go to church. So there's it depends on the person. Whatever works. Yeah. I had one person get clean and sober because Child Protective Services came to their house, and they stopped drinking because they didn't want to get their child taken away, and they were acting violent. So
I actually had a client recommend to me to see the film Beautiful Boy. I had read that book previously, which is a beautiful book about a father navigating his son's journey through addiction, but there is underlying mental health issues there for him. And then the young man wrote his own version of the book called Tweaked, and both of those are really good too, the books. And then if you're not a reader, the film is also really good, and it's sort of a compilation of the two books put together. I just want to take a moment and thank you both for coming in. I just so appreciate you sharing so much of your journey, and
Sure.
it's incredibly inspiring, and it's real because, it wasn't just a clean break and off to, it's been a lot of hard work over a long time, and I really appreciate the way that you've sort of laid that out so that people know realistically and can be gentle with themselves as they, go through ups and downs on their own recovery journeys.
Yeah. And I do think that if you feel like you're suffering from mental illness and you feel like looking for help is hopeless or something, it's not. It's really, things can be cured, and there's lots, we've talked about a lot of resources, and just it's an issue that's being thought about a lot, and you can definitely get there. You can make recovery.
Yeah.
So, yeah.
And I just wanted to say, there's hope out there. And that, to take care of yourself and reach out. And that if you're struggling with mental illness, it's important to treat both mental illness and addiction, because one can trigger the other. And know that you're not alone. Others have struggled and changed their life for the good. It's often I see people moving into careers because of the struggles that they've gone through to help other people. And that's pretty amazing when that can happen.
Thank you again, Cynthia and Rick, for joining me today.
Thank you for having me.
Thank you.
Well, that concludes the interview portion of our program. We next hear from a community member about their recovery experience with dual diagnosis. Here's Stephen.
Hi, my name is Stephen. I'm a 34-year-old addiction specialist at a drug and alcohol treatment facility. When I graduated high school in 2007, I never would have imagined myself doing what I now do. I partied in high school, sure, probably more than most, but did so in common strides with my close peer group. My path of recreational substance use, however, diverged from theirs when I was forced to drop out of community college to undergo a significant intestinal surgery. The surgery would see me spend 13 days recovering in a hospital. No food, no water, but a liberal supply of a powerful intravenous opiate, Dilaudid. A strange thing happens to the body when it is without proper sustenance. The senses for survival are heightened, smell and sight sharpen, and most dramatically the mind becomes singularly focused. This would serve an early human well with a distinct purpose to find food, utilizing their enhanced instincts outwardly. But I was not an early human, and this was not my situation. Instead of being able to express an outward purpose in a simple and meaningful way, I was stuck in a hospital with virtually unlimited access to a powerful drug I could self-administer every 15 minutes with the push of a button. I withdrew inward, into my own mind, and what I found there was a terrible amount of pain and darkness. I had many realizations as I endured the traumatic nature of post-surgery and starvation, but principal among those was the realization that I was legitimately suffering for the first time in my life. With my mind in a state of obsessive thought, it latched on to the notion of suffering and how much there is in the world. Death, loss, pain, fear, hopelessness. My obsession with these negative themes unknowingly shifted my perspective towards a victim mentality. After discharging from the hospital, having dropped out of school, losing my girlfriend, and overwhelmed by negativity, I soon became wildly depressed. Yet suffering was not the only thing I learned in that hospital. I also learned how to escape from it. Opiates over the next decade became my refuge from the obtrusive negativity that followed me around like a dark cloud. My depression and substance abuse worked in concert to form a negative feedback loop that plunged my spiral in an ever-tightening and downward direction. I could not break free. My wheels were spinning, if not altogether stuck. The amount of times I dropped in and out of college increased. My rap sheet got longer. My friends disappeared, and my family, out of preservation, had to let go. This was not working. I had to do everything different, and so I did. I know this short anecdote barely brushes the extremely nuanced canvas of substance abuse and mental health. Many more strokes are required to paint a complete picture, but I hope I can use it to highlight a few things I wish I knew earlier. 1. Substance abuse will only serve to provide a temporary escape from the pain at the cost of intensifying it and prolonging it. 2. A victim mentality does not allow for self-progress and growth. 3. Depression, at least for me, is seemingly rooted in the disconnect between ideas and action, and a distancing from both people and purpose. And 4, depression is a paradigm of negativity. You cannot see the positively beautiful wonder of the world while trapped inside, but there is absolutely a way out.
I want to say a huge thank you to our guests today, Rick and Cynthia Nollenberger, to our In Your Voice story contributors, and thanks to you for joining us here on State of Mind, Being Human and Living Well. New episodes of State of Mind exploring mental health and wellness are released the first Sunday of every month and can be found along with our complete archive on our website, www.stateofmindmedia.org. Also, if you found today's show interesting and you'd like to learn more, or you're looking for resources for yourself or a loved one, check out all the resources posted in the show notes on our website. If you missed part of this episode or just want to hear it again, subscribe to our podcast on all the major podcast platforms, including Apple, Google, Spotify, Stitcher, TuneIn, and on your home smart speaker. Also, when you rate and review our podcast, you actually help it get found and heard by more listeners. So please, could you do that for us? Special thanks to Jeannie Baldzikowski for audio production, to Leslie Nielsen for community outreach, Patrice Vecchione for In Your Voice story coaching, and Lisa Herendine for research. And thanks to acoustic guitarist Adrian Legg for composing, performing, and donating the use of our theme music. State of Mind was developed and originally broadcast in association with KSQD-FM in Santa Cruz, California. We always want to hear from listeners and community members just like you. You can submit your very own In Your Voice recording and become part of the conversation. You can either call in and leave a message or record the audio file right on your phone. Either way, tell us about a mental health experience you've had, something that's contributed to your mental health recovery, or share a resource that's been helpful for you. We're now looking for In Your Voice contributions from people who have experience with ketamine-assisted therapy. We really do want to hear from you, and your voice may just be on one of our future shows. Submission details can be found at www.stateofmindmedia.org. Come on back and join us next month for a whole new episode of State of Mind. Until then, live well.